I'm Dr. Aditi Aggarwal. I'm a Senior Consultant Radiation Oncology at Paras Hospitals, Gurugram. And today we'll be discussing about glioblastoma, which is the most common occurring brain tumor in adults. Amongst gliomas also, glioblastoma is the most common and the most aggressive form of brain tumor. The symptoms are quite non-specific and they may overlap with other common non-cancerous conditions as well. The common symptoms are headache, nausea, vomiting. When I say headache, it could be a headache that was persisting and there is a sudden change in the nature of the headache. Or it could be a headache that has just started for a few days. So glioblastoma is a very aggressive kind of a tumor, which means that the cells are rapidly multiplying. So the history is usually short. Somebody who's having a headache for say 2 years or 3 years, and then that person is diagnosed to have a brain tumor, is most likely a low grade glioma. But for a person who's had a short history, say 1 month, 2 months, severe headache associated with nausea, vomiting, sometimes may be associated with seizures also, or may be associated with other symptoms depending on the location of the tumor. For example, if the tumor is in a location which is affecting memory, so there may be short lapses of memory which has not happened to that person, or there may be some difficulty in vision or some difficulty in speaking. So depending on where the location of the tumor is. So that is the difference with other brain tumors also, that usually it has a short history. And most commonly, it is headache, nausea, vomiting with or without seizures. Most of the times it presents with headache, nausea, vomiting. Why are these symptoms happening? Because the tumor, that is the growth of cells inside the normal brain, it is causing pressure and it is disturbing the circulation of the normal fluid, the CSF inside the brain, or it is causing pressure on the normal structures. So the primary treatment initially is surgery. It helps us in two ways. First of all, it decompresses, so the symptoms are relieved immediately. Secondly, we get a tissue diagnosis. We get to know that this is glioblastoma. I'm talking about history. There are certain features that are suggestive on the imaging like CT scan and MRI also. But none of that is confirmatory. So only when we have tissue that is taken out at the time of surgery and we examine it under the microscope, हमें पता चलता है कि this is glioblastoma. So after surgery, which in most of the cases is maximal safe resection, that means the neurosurgeon removes as much as possible of the tumor that can be removed safely. And if at all some tumor is in a critical structure, it needs to be left behind, it will have to be left behind. So irrespective of the extent of resection, after that, radiation treatment along with capsules or chemotherapy of a drug called temozolomide are started. Now radiation helps in causing a growth restraint. That means it stops the further growth of these cells. It is a very aggressive type of a tumor. So if this tumor is just left behind, or even if the complete tumor is removed, and after that no further therapy, no further treatment is offered, it is bound to come back within a few months. So radiation helps us in pushing that time period, in increasing the time period of the tumor coming back, which we label as progression-free survival. That means the time the tumor has not come back and the patient is free from any progression of disease. And it definitely has an impact on overall survival also. That means the survival, the time the patient is going to live with or without disease, is also beneficial if we give radiation. Whenever we give radiation for any particular disease, it is given only when it is absolutely required. It is given only when we know that the benefit that we are getting with radiation outweighs the side effects or the risks we can have now or in future. So radiation, it does have some side effects, though none of them are life-threatening, none of them are significant and major to hamper the treatment. So the acute side effects may be in the form of some nausea or vomiting. That means a tendency to vomit, or there may be some headache depending on the location of the tumor, depending on how well the tumor has been removed, depending on the edema inside the brain. And usually these symptoms are well managed with medicines. When I talk of late side effects, so late side effects happen after say 6 months or 9 months of treatment. So in few patients, say if we treat 100 patients of glioblastoma, 10 or 12 may have some radiation related changes in the brain, which would have similar symptoms as of the tumor. That means the patient would again have headache, nausea, vomiting, and may have seizures, which are actually not happening because of the progression of the tumor, but they're happening because there is swelling inside the brain, or there are changes inside the brain because of the radiation and the chemotherapy capsules that we have given. Out of 100, only 10 or 12 are developing those symptoms, and the other 88 are not developing. So there are side effects, but yes, the benefit outweighs the risks. So we offer radiation to all patients of glioblastoma after surgery. So glioblastoma, as we were talking about, is an aggressive form of tumor, but it does not mean that treatment should not be done because it is aggressive. Maximal safe resection, that means a surgery that is done by a good and experienced neurosurgeon to remove the tumor maximally. And then radiation and chemotherapy should be given, it should be taken by all these patients because it has an impact on increasing the time period with disease as well as the time period without disease. Both the time periods are affected. In the end, I would just like to say that awareness is actually what is our power, and we need to be aware of it, and at the earliest doubt we should consult our doctor. That is what can help us to deal better with the disease.